I'm Dr. Steve with my little pal, Dr. Scott. Traditional Chinese medicine provider gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question or you're embarrassed to take it to your regular medical provider, or you just can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net for the best CBD nasal spray. Is it the only CBD nasal spray? I'm not aware of any other.
There are no others.
I didn't think so. There may be, but if there is,
Not as
good.
Not as great.
All right, very good. All right. Well, I have a topic for today, and it is this City of Hope announced promising results for a new chemotherapy pill that appears to, quote, annihilate all solid tumors.
Oh, wow.
According to research published August 1st in Cell Chemical Biology. So we're going to be looking at that one. Mm-hmm. Data from the preclinical research, in other words, not before clinical trials, has so far demonstrated effectiveness in fighting cancerous cells, including those caused by breast, prostate, brain, ovarian, cervical, skin, and lung cancers, the health system stated in the release. So let's, I would like to look at the original paper here, because this is some really breathless reporting that's going on over this thing that has not been studied in a clinical trial yet. So they, in their summary for this paper that they printed in Cell Chemical Biology, which is, listen, I'm not in the basic science thing, so I've never heard of this journal. It says, targeting transcription replication conflicts, a major source of endogenous, in other words, inside the body, DNA double-stranded breaks, and genomic instability. Okay, so what they're talking about is just things that mess up your DNA could have important, and targeting those things could have important anti-cancer therapeutic implications. Absolutely. Totally agree with that. Mm-hmm. You know, some particularly spontaneous or even genetic cancers caused by some transcription error in a cell that then goes, whoa, I'm more successful than the cells around me, and it starts to grow, right?
Right.
So anyway, there's this proliferating cell nuclear antigen, PCNA, is critical to DNA replication and the repair process. Through rational drug design approach, we identified a small molecule PCNA inhibitor, and the molecule in question that we're going to be talking about is called AOH 1996. It selectively kills cancer cells. This AOH 1996 enhances the interaction between this PCNA and the largest subunit of RNA polymerase. Don't worry about that. Okay, so what it does is it induces, it fucks with this system. Okay, that's the easiest thing I can say. Now, it says it suppresses tumor growth as a monotherapy, in other words, by itself, or as a combination treatment, but causes no discernible side effects. Okay, first off, I don't like the fact that they use the word side effect. They're adverse effects.
Okay.
I mean, that's not really the scientific term for this, side effects. Mm-hmm. Inhibitors of transcription replication conflict resolution may provide a new and unique therapeutic. So how have they determined that it doesn't cause side effects. So right now I looked at clinicaltrials.gov. They are doing a phase 1 trial. It's undergoing. It's happening now. This phase 1 trial studies the side effects. Oh, stop calling it that. And best dose of AOH 1996 in treating patients with solid tumors that do not respond to treatment. Okay, in other words, refractory. These are people who have been tried on other things, and then they're going to just throw this at them. And, why wouldn't you? If everything else didn't work, you'd try something.
Yep.
AOH 1996 may stop the growth of tumor cells by blocking some of the enzymes needed for cell growth. So the objectives of this trial is to determine the maximum tolerated dose. So they're just going to give them more and more and more until people go, stop, you're giving me too much. Right. And then that will help them recommend the proper phase 2 dose. That's where they give it to a lot of people and look for efficacy. And then the secondary objective is to determine the pharmacokinetics. So this phase 1 trial, where they're like, it's in phase 1 trials. The only thing that they're doing, you get about 40 people, and the only thing you're looking at is what's the maximum dose. They're not even looking at whether it actually works in humans. Okay. What I want to do over time, and I will look at this, is how did they determine that this was a molecule that they could give to human beings orally? What process did they go through? They go through rats, they go through monkeys. What did they do? And but anyway, the quote from City of Hope was able to develop an investigational medicine for a challenging protein target. We discovered PCNA is one of the potential causes of blah, blah, blah. Now that we know the problem area and we can inhibit it, we will dig deeper to understand the process to develop more personalized, targeted cancer medicine. So this is so new. Okay. We don't even know if this is going to do anything in people. Now, if it will, this is awesome.
Shoot you.
But here's the problem. So now I'm just going to Google new cancer pill. And then let's just see what the headlines say. New cancer pill shows some promise. Many doctors say too early. Good for them. That's actually Fox9.com. That's some local Fox station. Here's New York Post. New cancer hope as pill kills tumors. Thanks to little girl. Apparently, they had some pediatric patient that had recurrent tumors, and they gave it to her. Let me see. Oh, here. Cancer-killing pill, in quotes, that appears to, quote, annihilate. All this come on. This is way too early to be.
It's an awful bold statement, isn't it? This early. Yeah.
New pill targets undruggable protein to selectively kill cancer cells. Yeah, I'm assuming that the cancer cells that were killed in the laboratory. Now, okay, let's look at the New York Post thing. They're talking about this little girl, and let's see what her story is. Researchers developed the drug, blah, blah, blah. Okay, we all know the drug. It's AOH 1996 is named after Anna Olivia Healy, a cancer patient from Indiana. I knew I wanted to do something special for that little girl. Linda Malkus, City of Hope in Duarte, California, a leading cancer research center, said. So when she was only 9 years old from neuroblastoma, a children's cancer that affects only 600 kids in America each year, he said, I met Anna's father when she was at the end stage. He asked if I could do something about neuroblastoma, and he wrote my lab a check for $25,000, which apparently the money opened their eyes a little bit to something. And they said that was a moment that changed my life, my fork in the road. Maybe you could have paid attention to this kid without the check, but okay. Yes. The dad was like, hey, can you do something? And let's see here. So young Anna's, let me see. Okay. My wife, come on, did they give it to her and did it work? now that we know we were too late to help Anna.
Oh,
for God's
jeez.
sake. And it's,
That's terrible.
but we could help others like her. Look, what is this article? New Hope annihilates all solid tumors thanks to this little girl.
Except for the little girl. That's a terrible
that's
story.
horrible.
That's a terrible story.
And the way that they're using them in these things, it's like you're assuming that what this means is they gave it to this kid and she's walking around today.
Yep.
I had no idea. I apologize to
You
everyone.
should.
Well,
Oh, my God.
these journalists should apologize because New Hope as a pill, quote, annihilates all solid tumors thanks to this little girl. Come on. Well, our hearts go out to Anna's family, and she is a cute kid. And I hope that maybe, I don't know what the connection is between the dad sending $25,000 and them naming the drug after her. I guess that's it. But anyway, good Lord. So stop it with the shitty journalism, please. You know, I have a real thing about shit medical journalism, and this is a pretty good example of that.
If that's not the best example I've ever heard.
Isn't that something?
That's awful. Lord
Anyway,
God.
bummer.
That makes me want
All
to...
right.
Show's over.
Yeah, Sheldon, I was going to say, it makes
Great show.
we should have saved the best for last there, Dr. Steve.
Anyway,
Oh, my
Jeez.
God.
holy moly.
That's the worst.
God. I'm sorry. I'd say just stop this show cold. So I hope after all this, I really do hope that this is successful. But I really
Me
wish
too, poor thing.
that these, I understand. Listen, City of Hope's like, oh, we got something. This is a news story. Stop going to the news and just publish your data.
Right.
When we have the data,
Then
we
you'll
will
be
celebrate.
famous.
Yes.
Then you can be famous.
Then you can get the blowjobs.
Yes. Then you'll be the wealthiest person in the universe.
Or just the blowjobs.
I
That
don't
would be
think
enough.
blowjobs and this little girl,
No, I'm not,
That's-
honey. It's
poor taste saying that.
I'm not. All right, I'm talking about their motivation.
I know what you're talking about.
Okay, well, I've always said that when people call in and they say, "You doctors are just suppressing the cure for cancer," I always said that I would, if that were true, if it was something like, "Hey, all you got to do is take this specific dose of vitamin D." And we knew that, but we were suppressing it because we want to sell people chemotherapy. I would reveal it just for the blowjobs. That's what I always said. So that's what I'm talking about.
not for the money.
It's complete right. It's not the money. Jesus Christ. Anyway, I get it
Lord.
that it's kind of in the same realm temporarily, but it's a different subject. But anyway, All right. Yeah, I can tell you're convinced. But anyway, this is some bullshit. I don't think the molecule is necessarily bullshit. What's bullshit is going to the press with it. Just do the work, publish your data, get through phase 1, for God's sake, before you start getting these journalists all revved up on a cancer kill that annihilates solid tumors. And we're rooting for you. Don't get me wrong. We're rooting for you to be right.
Yep.
Because, I'm in my position right now because I didn't want anybody else's mom to go through what mine did. I absolutely don't want anybody else's family to go through what Anna's family went through. So if there's something there, go for it. But God, anyway.
Poor things.
Yeah. And it just seemed, okay. Anyway. All right.
Hey, next topic.
Yeah.
Yeah, please.
It's distasteful.
Yeah.
It's distasteful.
It is. No, it is terrible.
To me.
It is. No, I agree.
Okay.
Act
I'm
like
glad
you've been
it's
there
not just
before,
me.
people.
Yeah. All right. Tacey, you got some topics?
I have a few.
Okay.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Well, hello, everyone. So I only just brought up topics this time because Steve said last time I was talking a little longer.
What?
And well, you did.
No, I did
And so now
not.
we're just doing. I'm just doing topics, and then we'll talk about.
No.
Oh, yes. So why our body and brain need a vacation. Spending money on vacation brings more lasting happiness than material things. So doing meditation during vacation may help prevent fast decline of its positive effects. So if you meditate on vacation, then your positive effects last even longer. Not much agreement about how long a vacation needs to be to get the most benefit.
Permanent.
But the pandemic did cause stress, of course. Time off from work is good for our bodies and brains. It increases motivation, cognition, creativity, job performance, and even relationships. Old wisdom that says, what counts in life are memories of beautiful and meaningful experiences. Vacation increases daily sleep. Post-vacation sleep effects last about 2 weeks. Work engagement significantly increased. Burnout decreased, which lasted about a month. So this is a big duh, right? We all knew that.
Right. So you should take a vacation every month. Is that what you're saying? Because the
I think so.
the positive benefits only last 1 month. I think they last about 5 fucking minutes. I got back to
About time you
work
got
and
in
I
your
was
car.
immediately burned out again
Yeah,
after a 2-week vacation.
yeah,
Oh,
yeah.
I believe it.
Which wasn't the most stress-free vacation, to be perfectly honest, just because our kid got engaged and there was other stuff going on.
Yeah.
Oh, my gosh.
Topic number 2. A new vaccine shows promise of slowing or even preventing Alzheimer's disease. It targets the most common cause of dementia. The vaccine eliminates toxic cells in mice with the disease. It's called the SAGP vaccination, and it showed fewer amyloid plaques, decreased inflammation in their brain tissue, and increased behavior and awareness.
Okay, so this is a rat study.
Yes.
This is, again, preclinical. So that's interesting that they've got something. Here's something. This is from the American Heart Association. So that's a decent website to go to for stuff like this. Novel vaccine may hold key to prevent or reduce the impact of Alzheimer's. Now, look. It says a novel vaccine targets a protein involved in Alzheimer's disease. We call it dementia of Alzheimer type, but anyway, because Alzheimer, the guy doesn't own the disease. You know, that's these eponyms have got to go away. But anyway, helped eliminate toxic cells in mice with the condition. And after the vaccine, the mice had fewer amyloid plaques and less inflammation in the brain that showed, and here's the important thing, showed improvement in behavior and awareness. Now, if we can come up with a vaccine that will prevent Alzheimer's disease, hell yeah, I'm all in favor of that.
Yep.
Let's see some human data, but that's kind of exciting. I'm cool with talking about research. Just don't make any claims and don't drag families into it and stuff, for God's sake. Oh, my God.
We're all going to be scarred.
Yeah.
Anyway,
So
yeah, dementia of Alzheimer's type accounts for 50 to 70% of dementia patients worldwide. There's other types of dementia, frontotemporal dementia, or AKA Pick's disease, where people have this burst of creativity and all of a sudden they start painting or playing music and stuff, and then their behavior starts to change, and then they just decline. It's like The Fly. Remember The Fly?
Mm-hmm.
In the beginning, he had all these cool sort of superpowers, and then he got weirder and weirder, and then he just completely declined and literally turned into, a monster. And was kind of an allegory for how Pick's disease works, because you get this huge burst of creativity where people all of a sudden become great painters, or they become great poets or musicians or whatever, and then they stop taking baths, and then they, have difficulty maintaining relationships, and then they decline. So anyway. And then there's vascular dementia. That's where you have lots of basically mini strokes that attack parts of the brain. And those people will decline in a stepwise fashion as opposed to a gradual fashion like Alzheimer's does. So anyway.
Okay.
Good one.
Topic number 3. This is interesting. Leprosy could be endemic in Central Florida.
Yeah, what the hell's going on with that?
Yeah, this is from the CDC. Here's what to know. Central Florida accounts for 1/5 of cases reported across the U.S., 159 cases in U.S. in 2020. In 2015, experts blamed armadillos for higher than normal leprosy cases in the state.
Damn you!
Leprosy
Armadillos.
occurs when bacteria called Mycobacterium leprae attacks the nerves, which then become swollen under the skin. You can lose ability to sense touch and pain. Advanced cases, of course, you can lose fingers and toes. It is treatable, however. You can get it when a person with another word for them to call leprosy is Hansen's disease.
Correct.
Coughs or sneezes on you.
Again, Hansen doesn't own it, so
Yes. It's treated with
Bop.
2 or 3 antibiotics for 1 to 2 years. Early diagnosis is key, and that completes my time of topics.
those are very good.
Those are great topics.
Yeah. So, how do you diagnose leprosy? There's weird patches of skin. They look lighter or darker than normal skin, and then they have loss of feeling. And there was a book or a series of books about a guy that had leprosy called. Oh, shit. Now, I can't remember. Stephen R. Donaldson. Oh, God, I got to look it up. White Gold Wielder, I think. And what this guy had leprosy, and he would go into this other universe that was ruled by magic. And when he was there, he didn't have the leprosy, but he had a white gold ring. And apparently that was exceedingly rare in that universe, and it carried with it like magical powers. But he didn't believe it. It drove you crazy. You wanted to strangle this guy because he kept thinking he was in a dream and he wouldn't use his power. He could have fixed everything. And but anyway, that's it was talked a lot about the symptoms of leprosy and stuff that he had. But yeah, it is treatable. There are antibiotics. There's a cocktail of antibiotics. Did it say which ones that they used?
No, it did not. But it did say you had to take it 1 to 2 years.
Yeah. The mycobacteria are barely alive. They're sort of between bacteria and regular cells and viruses. They're strange. And they're hard to kill. Tuberculosis is a mycobacterium as well. And there's this one Mycobacterium avium that's a pain in the ass. Let's see. And they're difficult to treat. Treatment of leprosy. Let's find out what it is here. Dapsone, rifampicin, and clofazimine. So you got to take all 3 of those drugs. And as Tacey said, 12 months 6 to 12 months, right?
It said 1 to 2 years.
1 to
on
2
this.
years?
Mm-hmm.
Oh,
Oof.
But this, I forgot to say where this article came from.
that's okay. Yeah, combinations refer to multi-drug therapy. Duration of treatment is 6 months for PB. What's PB? Oh, PB is a case of leprosy with 1 to 5 lesions. Okay, an MB case is with more than 5 lesions. Okay. Yeah, it kills the pathogen, cures the patient. Early diagnosis can help to prevent disabilities. So there you go. And we're not recording. Fuck. Hang on. Okay, well, let me look it up then. It looks like you have to take a combination of dapsone, rifampicin, and clofazimine, and it's called multi-drug therapy. I wonder why. I wonder why they call it that. Thanks for letting us know, WHO. Yeah, when you take 3 drugs, it's called multi-drug therapies. It's very strange. Where did they get that term from? Ugh.
You see, You see? Your stupid minds. Stupid. Stupid.
Anyway, it says that the multi-drug therapy kills the pathogen and cures the patient. Obviously, early diagnosis and prompt treatment prevents disabilities. So, wow.
Why Central Florida, though? Why blame it on the armadillos? It did not talk about why they blamed it on the armadillo. It just said that it was blamed on them.
Why is leprosy
Do armadillos go around biting people?
No, I don't know.
I don't think so. I think armadillos are pretty
Don't they
laid
just
back
leave
critters. Yeah, they just kind of
people
walk
alone?
away if you don't mess with them.
They're
People,
excrement?
people aren't fucking armadillos, are they?
no.
Let's hope not.
Oh,
goodness.
for
That'd be
God's
weird.
sake.
No, that'd be weird.
Stop it.
This show has gone from bad
This
to
show is
worse.
terrible.
You're terrible.
It's awful.
Now, 95%
Now, they may
of
be
people...
licking armadillos,
Yeah,
just kind of licking them.
You think that's like a
possibly.
thing, like people licking toads?
And, yeah, or marrying, or licking their car or something like that.
Someone told them that licking an armadillo will get them high, or it's an aphrodisiac.
Exactly.
Now, here's the thing: 95% of people are resistant to this. So
wow.
there's only a subset of people that can even get leprosy. It says it should be assumed that an infected armadillo could be a source of infection to a susceptible person in contact with its bodily fluids or organs. So maybe, and it's not been identified in any other wildlife. And the CDC, advises, thank you, to avoid contact with armadillos whenever possible. Thank you.
Thank you, Captain Obvious.
Really? Ugh. Okay, and if you become in contact with an armadillo's bodily fluids, again, I'm raising the question.
No, don't you even do it. Don't you do it.
Then you should be seen by your healthcare provider, and they will monitor you over time. Okay.
I didn't know people could be immune, I guess, to leprosy. That's interesting.
Yeah. Yeah, you have to be actually genetically susceptible to it to even get it.
Isn't that wild?
Yeah. All right. Do you guys want to...
Number one thing, don't take advice from some asshole on the radio.
That would be 3 assholes on the radio today.
Well, there's
no comment.
me and...
Lord and Lady Douchebag.
All right. Let's get this going here.
Oh, my goodness.
Uh-oh.
Uh-oh.
Uh-oh. Okay.
Dr. Steve, longtime listener, back in the O&A days.
Hey, thanks.
Hey, I, 10 years old, realized I only had one testicle.
Uh-oh.
Because, you're with your buddies and obviously realize they've got 2. I've only got 1, so I'm missing 1. I realize that. I tell my parents, hey, I'm missing something here. We go to the doctor. They look around, can't find it. They think, well, maybe it's going to drop. Never. They can't find it. It's never been there. The only kind of record they have of it when I was born is when I was 6 months old. I had a hernia surgery. Could that have possibly done anything? Just checking. I've been fine. I got 3 kids, doing great. Just one nut, though. Never found out where it's at. Thanks, Dr. Steve.
No, dude. No, okay.
Wow.
Yes, the hernia surgery could have done something, but it's possible that they killed the blood supply to your testicle. Who knows, particularly if it was on that side, because all of those things flow down the same pathway that the hernia goes. So it is possible, but it'd be good to know. I mean, a urologist could go in there and maybe find a residual,
Teeny dried up raisin-looking testicle.
with an ultrasound in your sac, because what you want to know is that it's not retractile or has never descended, non-descended testicle. A non-descended testicle increases your risk of cancer.
Right.
So it'd be good to know where that thing is. So if it was in your sac and they killed it, no big deal. You got another one. too late to sue anyway, and there's nothing really to sue over. No real damages other
3
than
kids and all that.
Yeah. You're good on that. But it would be good to know where that testicle is and if it's still there. I would see a urologist, tell them your story, say I'm concerned that maybe I had a retained or non-descended testicle. Can you help dope that out? Because if it was in the sac and it's dead, that doesn't increase your cancer risk. But if it's up in your body, that does. Okay? Makes sense?
Yes, sir.
Okay.
Makes good sense.
Wanted to get that one out there. There we go.
Hi, Dr. Steve.
Hello.
Time to get back to the fun questions.
Okay.
Yay.
As we get older, does our sphincter, or as some call it, bunghole, become less elastic or stretching? As a 58-year-old male, I feel a little more strain pushing past the sphincter when having a normal bowel movement. Is there anything to bring back that stretchy sphincter? Thank you.
Sure, but what happens as we get older, particularly if you've had giant American turds, that we have caused some scar tissue in the old sphincter, little micro tears and stuff like that over time. And yes, that will decrease the elasticity. He says he's having to strain a little bit more to have what he calls a normal bowel movement. I would ask, well, how do you define normal? And I wish I still had the Citracel drop, because that's what I would recommend, is just adding more fiber to his diet and more fluids. Drink more water, take some Citracel. It's methyl cellulose. It's what they made slime out of in the Ghostbusters
60s.
movies. Ghostbusters movies. And the bacteria in your gut can't crack it, so it doesn't cause gas. It's the only one of those that doesn't. And it'll make your stools more fluffy and delightful.
What about internal hemorrhoids?
Yes, what about them?
Could that have anything to do with it?
Well, sure. Yeah, if you have internal hemorrhoids or external hemorrhoids, and eventually they scar down.
Or fissures, anal fissures will scar down
that
too.
was what and just micro trauma, it'll cause it. Now,
years of scarring from big.
I'm guessing
hard stool.
that you could go in there and take different sized anal
Like a stretching device.
dilators.
Yeah.
They have anal dilators, and you go bigger and bigger and bigger. They have vaginal dilators that do the same thing for women that were born with vaginal atresia, abnormally small vagina. And you go larger and larger and larger. I'm not sure that that's required here.
Yeah.
Unless it's really pathologic. And in that case, if it is, he needs to see a proctologist.
Yeah, make sure there's no real scarring that needs to be.
Or some other problem
something
that's
else,
causing him to have to strain.
Right.
The proctologists are just general surgeons that deal with ass issues. And there's so many of them that you can actually specialize in proctology. If you and you say, why would anybody do that? Actually, the procedures they do are pretty fun. They have some fun procedures,
and they can help really quickly too.
Yes, and and people will come in and they're miserable because you never think of your stupid anal sphincter until it causes a problem, and then that's all you can think of.
Yeah.
So if you live in a city large enough to have a proctologist, go see one. If not, just see a general surgeon. Just make sure everything's groovy down there. And then if it's just that you're a little bit older and your diet and you're not drinking as much fluids, then I think your version of normal stool has drifted a little bit. Just like the definition of being left of center has drifted some, You know what I mean? Politically,
Yes.
all of a sudden you have people like Elon Musk going, well, hell, I'm right wing all of it, but how did this happen?
Yeah.
He's not the only one. That is something that a lot of people have felt. But anyway. All right, here we go. Okay. So I went way back into the voicemails and found some COVID stuff that I thought would be kind of fun now in retrospect. And here's one that I thought was kind of interesting. We'll see if
Dr.
it is.
Steve, this is Rob from Fredericksburg. How you doing today?
Good, man. How are you?
Okay, hold it there. Enough about you. This is all about me. Just wanted to give you an update. I've been discharged from a rehab facility. I did about 30 days before I unfortunately tested positive for COVID.
Oh, yeah.
So I'm back home, spending out the next few days under quarantine before I continue on my regular life. But I'm just kind of curious if you had any information about people who were vaccinated, like myself, and the odds of them actually getting the COVID vaccine or the COVID virus. Would love to hear the answer. I'll talk to you soon. Bye-bye.
Yeah, vaccine breakthrough is what he's talking about. And I was vaccinated.
Mm-hmm.
I was too.
And yeah, Tacey was vaccinated. As far as we know, she never got it.
Oh, wow.
I was vaccinated and almost
probably
fucking died.
That's
from
what I
it.
think, probably.
Yeah.
When Stevie got it bad.
Yeah. He's old, though.
Yeah, so here you go. So if you're 65 plus and you were unvaccinated, the numbers were like 62% of cases were unvaccinated, but 30% were vaccinated without the bivalent booster, and 14% were vaccinated with the bivalent booster. Now, if you look at people who are 50 to 64, it was 5% vaccinated, 5% unvaccinated, 4.4 vaccinated, and without the booster, and 3.6 with. So the numbers are almost no difference. And then if you look at the young people, 3.3, 1.9, and 1.6. So it decreased it a little bit, but there's, it was almost the same number of people.
Right.
So the vaccine tended to not prevent you from actually getting the virus, didn't prevent you from transmitting the virus. What we did see was a decrease in hospitalizations in people who were vaccinated. So anyway. And then now if you look at this, unvaccinated people, this is the CDC, of course, 1.7 times more likely to be hospitalized. But it doesn't mean that vaccinated people were not hospitalized. Right?
Yes.
Right. Yeah, just more likely to be hospitalized. But, if you're vaccinated, you still got hospitalized. So anyway, yeah. And if anybody thinks, if YouTube wants to strike our channel because I'm saying these things, this is straight from the CDC. And the other thing is I'll be happy to show anybody what COVID did to my lung, vaccinated and with the monoclonal antibody, where I had to go to a cardiothoracic surgeon to consider taking out part of my lung. They decided not to do it for right now. They're going to wait a year, but that still may be a thing. Mm-hmm. And I had I had the vaccine before anybody else. I was in the vaccine trial with Pfizer, so I had my first vaccine in September of 2020. Got the virus during Delta of September of 2021. Can't believe Tacey and Beck and Liam didn't get it. So that's why I wonder if we did antibodies on you guys. I bet you would
probably did
be positive. You just had asymptomatic cases, which was also a thing. And I had the antibodies. The next day was basically well. The day after that, and never missed a day of work except I had a cough for about 6 weeks.
Yeah.
And a year later, they found this giant to me, an eighth of my left lung was just completely destroyed. So I can't imagine what would have happened if I hadn't had all that. I'm going to have to assume that those things helped me.
Mm-hmm.
Yeah.
So
absolutely.
When is the next time you have a scan or an image of your lung?
Year.
Okay.
Yeah, they're
Well,
going to
that's a
look
good
at it
thing.
in a year. They're going to see if it gets infected again. I had to drive to Florida while Tacey and Beck flew because that place got infected. And the problem with it is when you have scar tissue that big in your lung, and if it gets infected, it can't clear it. There's no cilia in there. The white blood cells can't get in there. It's a problem. I had to take antibiotics for a year. I considered filing a workman's comp claim, but there's no real, there's no comp unless I could just make sure that my medical treatment going forward was covered.
Yeah.
You know?
Which is important.
That's not a bad idea.
Yeah. Well, I've got literally 13 days to
Do it. File the claim.
Yeah.
File
to
the claim.
Yeah. But anyway,
No, that's not.
so
gonna happen.
yeah, so that's a really interesting question. Back then, we didn't know. This guy was like, "Well, I got vaccinated. What the hell? How did I end up
I
with
get
COVID?"
sick?
Now we know that people who got vaccinated still got the virus.
Mm-hmm.
You know. Anyway, all right, we'll be talking about this shit forever.
Yeah,
That's the
forever.
thing. All right.
Hello, Dr. Steve. This is John from Chicago. How
Hey,
are y'all doing?
Good, man. How are you doing? I hope you're
Great.
well.
I'm doing swell, too.
Excellent.
Thank you.
You're welcome.
Hey, I have baby blue eyes. Always had them. Didn't
Excellent.
just get them.
Mm.
And some people say they like the look of them, but the older I've gotten especially, I hate them because they are so much more sensitive to light.
Wow.
And because of the lack of pigment. Is there two questions? One is, does everyone's eyes just get more sensitive to light as we get older? And number two, for people in the blue eye category, such as myself, is there anything we can do to make our eyes more tolerant to light exposure as opposed to just wearing sunglasses all the time, even when it's overcast out? That's how much of a baby I'm at. And I assume staring directly into the sun is stupid as hell.
Yeah, don't do that.
Don't do that.
That's stupid. Whatever kind of eyes you have.
That's-
I don't know.
Good answer,
Just
good
curious
answer.
if there's any way to train the old eyes to
No.
handle light. Anyway, thanks a lot. Love the show.
Yeah, it'd be nice if there were just a switch, you could just turn down the signal that's going to the brain. But it just transmits whatever signal it wants. The iris is supposed to control some of that. And so when you're exposed to light, there's a circuit that says, okay, there's a certain number of photons hitting the retina. It sends a signal to the muscles of the iris, the colored part of the eye, that decreases the pupil size. And but the problem with blue eyes is the iris itself is translucent. So it can close all at once and the light still gets through. So it seems to me one thing that you could do is you could wear contact lenses that change the color of your iris.
Yeah.
The dark, yeah.
That would be one thing, but it's a pain in the ass.
Yeah. They're really cool, though.
They
They're
are
cool
cool.
looking.
Yeah, you could have all kinds
Cat
of
eyes or
wacky colors
Yeah.
and stuff.
Neon.
Purple. And,
Yeah. The other thing that you could consider doing, which I have no, don't do this, but I know, don't consider doing this. Let me take that back. But I have heard of people who have tattooed their iris.
Oh, I knew you were going to say that. Yeah. No, I have too.
Don't
I've
do
seen
that.
it. Yeah,
Don't
don't
do
do
that.
Don't do
But if anyone has done that and they've had experience with it, let us know. I don't have any data on that. Now, the other side of it, though, is because they are more light sensitive, what would follow from that? What benefit could there possibly be from blue eyes?
Girls think we're more handsome.
Nighttime.
No, I think it's because girls think we're cuter because we have blue eyes.
Well, it is weird that must be some. There must be some genetic benefit that we don't know that would make women want to mate with guys with blue eyes. That is weird.
I think it's because we're the minority.
You think that's what that people like? That women like minorities? No, I'm just saying.
No, we're maybe not.
That somehow that gives you an advantage.
A uniqueness.
Yeah,
Yes,
okay.
that's what it is.
People with blue eyes tend to see better at night, unless there are bright lights.
Correct.
In that case, the lack of melanin makes them sensitive to light at night, as they are during the day. So, but that would be the only thing. Now, he asked another question. When you get older, do things change? Yes, there are some conditions. If you notice that you are becoming painfully light sensitive, you could have a couple of medical conditions. One of them is dry eyes.
Sure.
You would also notice that as you look at a computer screen after time, starts to become blurry or hard to see, get some, you can buy over-the-counter eye drops called Cystane Ultra. Those are the ones I like. Put them in, see if that makes a difference. But either way, see your eye doctor if you're noticing light insensitivity. Light sensitivity, because glaucoma is also a cause of that. And glaucoma being increased, usually caused by increased pressure of the brain. Increased pressure on the inside of the eye that causes the retina to deform and sending signals to the brain that are incorrect. And so that's one thing, and that can cause blindness. So go get your eyes checked. They check the pressure in your eye every time you go. It's very simple. They can do it with a little puff of air now.
Yep.
And so get that checked. And there are other things, too, that could cause inflammation inside the eye, retinal detachment. Normally you would see flashes of light, but it could cause increased light sensitivity. And uveitis, which is an autoimmune inflammation of parts of the eye, those can cause light sensitivity as well. So if you notice that, just go get it checked. If you do, and you heard us say this, and you went and got it checked, and that's what it was, and they saved your eyesight, let us know. I might need it.
Hey, can I say before you go to the next subject real quick? And
yes, of course.
If you have really light eyes like I do, and I'm sure
I've never noticed that you have blue eyes, because I'm not in the habit of like gazing into the eyes of a man that I know.
I think you only see the red swollen eyes, and after
I just see the
my emotion.
That's all I see.
So anyway,
that's all anybody sees.
Hey, that's probably true. Sunglasses are vital for people with light-colored eyes for sure, and hats are vital too. And
if you want to save money on Botox, of the women and the men out there. Wear sunglasses when you go outside. It's the number one thing you can do to prevent those wrinkles.
Yeah, and all of my stuff, my house, my office, everything is really, really low light. Yeah, I mean, I even cover like the lights, so the light's not so much. I see better when it's a little bit lower light.
Isn't that interesting?
Yeah.
Wow. Yeah, that's interesting.
So my concern would be for him, just make sure that eye protection is really important.
And transition lenses may be the thing.
Transition
for people
lenses
with blue eyes.
are good things too. Yeah.
They actually work pretty well now. These are lenses when you go outside, they get darker, and when you come inside, they get lighter. And they're still crazy expensive, but if you have problems with light sensitivity, that might be worth the money.
I really like mine. I really, really
you have
like
them.
Mm-hmm. I haven't been wearing my glasses.
Yeah, I've never seen you wearing
anymore.
your glasses.
She doesn't have to read. She's retired.
But when I do wear them, I really like them. Yeah, makes a big difference.
Well, ain't she something?
She's special.
She surely is. All right, this is one for Dr. Scott. I think.
Hey, folks. We'll see if you've ever heard of something. Scott, it might be more in Scott's wheelhouse, but
this is a familiar voice.
Yes,
Sheila
it is.
G. Rosin.
What?
I've been doing this about the last.
Wait, let me run it back.
Sheila G. Rosin. I've been doing this about the last 2 months just to see if it helps anything. Stuff is disgusting, but I was also trying to find just some decent information.
I think, okay, hang on. Maybe that was on his side.
Yeah, because that's why I didn't move. I didn't touch it.
Yeah, no, let me run it
earlier.
back and see if it was somehow on the recording. Okay, hang on.
Sounds like it's on the recording, doesn't it?
Isn't that weird?
What about that?
Okay, let's do it right there. Okay, if it starts back up again when he's talking, we know it's on that side, but that is very strange.
Right
okay. But it's around 40 minutes in. That's when it did it last time, too. That makes me wonder if it isn't the battery in that mic. Okay. But we'll just see if it is, and we'll just switch like we did last time. We'll finish the show. Cool. We're almost done anyway. Okay. All right. Well, let's take this one here.
Hey, folks. We'll see if you've ever heard of something. Scott, it might be more Scott's.
That's a familiar voice.
Wheelhouse, but Sheila G. Rosin. I've been doing this about the last 2 months just to see if it helps anything. Stuff is disgusting, but
Sheila
I was also
G.
trying to
Rossum.
find just some decent information about it. Didn't know if you knew anything about it or not. Thank you. Bye.
Wasn't Sheila G. the drummer for Prince? No, it was Sheila E.
I was thinking the same thing. Sheila G.
Sheila.
Who cares?
G.
She was
Rossum.
awesome. She was awesome.
No, she was awesome. But what the hell is he talking about?
You tripping?
I'm looking.
Oh, I found some rosin.
Okay, you did?
Yeah, but I don't know if this is right. I see. No, I know marijuana. They make a rosin.
Resin.
That's pretty
Sheila
strong.
G.
Resin came up.
He
for me.
maybe
It
take
did?
Did it really? I don't have
Okay,
anything.
well, rosin is a different thing.
Well, but no, they use.
Shilajit.
Yeah,
Oh,
Shilajit
Shilajit.
resin. Yeah.
That's different.
Okay, you know what that is, right?
Shilajit has been used for inflammation.
It's fulvic acid.
Yeah.
Yeah. Well, okay. Now
that makes sense.
Shilajit.
I was like, man, I love Shilajit. She was awesome.
Yeah, it was
Except
Sheila
Except
E.
of course she was Sheila E. Damn, I'm a regular genius.
God, we're just we're
regular genius.
He's a fucking idiot.
Oh my god! Yeah, I think they use it as a for inflammation and toxin
it's
toxin remover. It's like
it's scraped off a rock.
Yeah,
is what it is.
right?
Right?
Yeah, and I think it's probably just fine as long as you don't have any side effects to it. No.
It says here, Shilajit is sometimes referred to
Shilajit.
as a. Is that what I said?
I think Shilajit is correct. You are right.
Oh, okay.
Yep.
Is referred to as a mineral tar resin, but it's not actually either of those. It's a highly viscous substance like tar or resin that's very dark brown or black in color, but unlike these is readily soluble in water, but insoluble in ethanol. It's composed of 60 to 80% humic substances, such as humic and fulvic acids.
Right.
Wow.
Which means it's a big chelator. Just
is that why they're
yeah,
yes?
that's
Okay.
what it is, yeah.
All right. Interesting.
Yeah. No, I'd say take it and see what happens.
Well, okay.
I mean, no,
unless it's toxic.
well,
I mean,
hey, listen, we know who it is. He's tough. He can handle it. And for $100, he'll do anything.
Research. Well, now that is true. Okay, it says natural phytocomplex with potential precognitive stuff. Okay, increases spermatogenesis, combats anemia, boosts. Aha!
Now we know the
testosterone.
Now we know. We're getting to the bottom of things.
now
It
we
increases his seminal fluid.
Shilajit can increase testosterone levels in the body. I want to see data on that, but I will. Will you put that down for next time?
Yep.
And we're going to do. Maybe Tacey could do a Tacey's topic on Shilajit and see if there's actually any. Here's something.
How do you spell it again?
Shilajit.
I'll show you, Tace. I wonder if you did a comparison between Sheila E and Sheila Jeet, which one would cause a better testosterone,
a better erection.
That's right.
It says here. This is from National something of Health. Here, let me see. National Library of Medicine. It says a potent and very safe dietary supplement, restoring energetic balance. Oh, this already sounds biased, and potentially able to prevent several diseases. Okay, so we're going to see if there's any actual data on this that is worth anything. And I'm always interested in new supplements that I haven't heard of before.
Oh yeah.
Oh, by the way, the data that said, or the article that said taurine is the fountain of youth. I took it for like 3 days, 1,000 milligrams, and if I didn't jump off a cliff, Tacey would have killed me, and everyone around me would have killed me.
I saw it in the trash.
Yeah, that did not work for me. Now, can I do taurine and a little energy drink from now and again? Yeah, but I think even the Celsius are making me goofy. But I felt I didn't do Celsius and I didn't do modafinil yesterday. I have narcolepsy. And then I felt like I had the flu and I was dying. But then I slept 10 hours last night.
But then you got to get out of sleep.
Now, but you probably needed it, though.
Yeah, no shit.
I think I had something, though, because you felt tired yesterday. Carissa was over yesterday. She felt tired. And a bunch of people around us felt that way. So I think maybe we may have actually had something. I don't know. Who the hell knows? Who the hell knows? All right. Well, thanks, everybody.
We apologize.
Tacey
beginning of the show,
apologizes
anyway.
for her husband because she's embarrassed for me. We'll see you next week for the next edition of Weird Medicine. Thanks. All right.
Oh, my God.
Do you have any stories to do out there?
Yeah, we got one question.
Okay.
If I can find it.
Sheila.
Oh, my God. Tacey, can you imagine? If I would have brought a story like that and read through the whole thing before I pre-read it, he would have chewed me up.
What?
He would have chewed me up.
Well,
one
no,
time
yeah.
or the other.
Do you
He
think
would
I
have
wasn't
known.
chewing myself out, you fucking asshole?
Well, that's why we weren't piling on. I was like, God, that's a worst story I've ever heard.
Oh, it was terrible.
Oh my God, it just makes you want to just cry for those people.
Yeah.
It's
And then they're using
they're
them.
using that. I don't know what.
I mean, really using them. Oh, we're going to name it after. And no,
No,
I mean,
don't
what are
name
you
it after.
doing?
Don't do that. Just
I mean,
shut up and do your research. You know.
I mean, it helps to get funding when you do that because you've got a story to tell. I guess that's what it is. But I don't know. I mean, I don't know anything about it. That's the thing. God bless the family and that poor little girl. Yeah. And if they can cure neuroblastoma for her, well, good for them.
Yeah, for people moving forward, it'd be wonderful.
Yeah. Anyway. Ugh.
Poor thing.
I just don't like. Well, I mean the headlines.
Oh, I know it.
Kills cancer.
Yep.
All
Solid.
because of a
All
little
solid
girl.
tumor.
And it's like, oh, well, that sounds like a heartwarming story.
Sounds like the best story ever. This girl's got an awful cancer, and she's.
Yeah. Anyway,
Yeah.
we all had that same fantasy.
Daggum.
Okie doke. Okay, that's Patreon. Here we go. Okay, you ready?
Give me 30 seconds.
Okay.
I'm just finding a question.
Echo. Count to 12.
Okay, here's number counter. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Okay. All right, you ready? Or no?
Not yet. Oh, here we go. Yes, Steve, I'm sorry.
What is it?
It's okay. Hospital breathing treatment goes through a nebulizer machine and looks like smoke.
Yeah.
Is that the same mechanics of using weed through a bong?
Interesting. Okay.
Yes, it's a great question.
Okay, I have the answer. That's very interesting. Okay, you ready?
Yes, sir.
Okay, before we go, Scott, you have something, a question from the Fluid family in the waiting room.
That's right, Donna Bell.
Donna Bell.
No, Donna Bell. She's
Ding,
asking.
ding, 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 Donna Bell. Oh, I don't know.
When she
Anyway,
comes,
what am
when
I
she
doing?
comes. So a hospital breathing treatment goes through a nebulizing machine, and it looks like smoke.
Correct.
Is that the same mechanics of using weed through a bong? Is that being nebulized?
That is a fantastic question.
Good question.
So the way the nebulizer works in the hospital is that you take a solution of whatever the medicine is. Usually it's albuterol, which is a bronchodilator. It's something when it hits the cells in the lung, causes them to contract. It opens up the airways. They will sometimes put another medication called ipratropium bromide in there, which will decrease mucus production and do some other things. Or you could put morphine in there. Sometimes we'll put morphine in the nebulizer. But you put it in the machine, and then it actually aerosolizes it. It's a very small aerosol. And you can do ultrasound nebulize. It's even smaller particles, but it makes a mist. And the mist, you inhale it, and then she noticed that most of the medicine goes out into the atmosphere.
Okay.
You only get drug when you're inhaling.
Gotcha.
Now, they've got new nebulizers that, for whatever reason, never really seem to hit the market, where it would only inject the medicine when you were inhaling, so you weren't wasting medicine.
Seems like a great
makes
idea.
sense, doesn't it? Yeah. Anyway, so that's that. Now, the way a bong works is very different than that. A bong just uses uses the water to cool and filter out a little bit of shit. So the pathway of that is you put whatever the substance is that you're going to burn or inhale. It could be tobacco, and it's a hookah or pot, and we call it a bong. And you light it on fire, and then the smoke is now drawn through, because you're inhaling, through the water, bubbles through there, is cooled, and some water-soluble substances will be left behind, and then the smoke travels up and into your lungs. So that is more of a filtration type of a system.
And cooling, too.
A cooling and filtration type system, whereas the nebulizer is an actual aerosol aerosol system where, hopefully you get all the medicine at once, and you can actually, make one that does that, but it's got a lot of moving parts. So anyway, that's a great question.
Great question. Yeah. Thank you, Dr. Steve.
And it does look like smoke, but it's not smoke. It's not products of combustion. It is actually just the stuff that's in there. It's just nebulized. So it's closer to steam, but it's not steam either. It's really just a mist. It's closer. It's like fog.
Mm-hmm.
Yep.
Okay.
Great.
All right. Any other questions from there?
Nope. They'll do her.
We have one other one here about nasal allergies, which we're getting into fall allergy season, so I thought it would be.
Hey, Dr. Steve.
Hello.
I've been listening for a while since
Yeah.
my husband got me hooked on your show.
Uh-oh.
But calling for the
Smart
first
man.
time.
Thank you.
So I have a question about allergies.
Okay.
I'm a 38-year-old, and I have been a long-time allergy sufferer, pretty much my whole life. Basically, everything environmental that blooms in every season here where I live in Alabama.
Preach it, sister. I'm the same.
Dust, mold, if it's got fur or some kind of dander, I'm allergic to it.
I'm lucky on that. I'm not allergic to dogs or cats, so that's good.
Started allergy shots last year, but I'm also taking over-the-counter medications on bad days. And so bad days, if I have an attack, it's, the sneezing, itchy, watery eyes, itchy face. And Benadryl is the only thing that gives me immediate relief, but it knocks me out even if I just take like a half. And so I'm wondering if you knew of anything that might work just as powerfully as Benadryl, but doesn't make me fall asleep as soon as I take it. I appreciate you and Dr. Scott so much. Take care.
Not you, though, Tace.
She's sassy. She's sassy.
I can't. I was looking for the old lady laughing. Oh, there she is. All right. So a couple of things. Tacey, you had this problem recently and actually got benefit from the Navage. Mm-hmm. So if you've got if you have a bunch of allergens in your nose, your nose will, the cells in your nose will explode these things called mast cells, and you get histamine release, which causes fluid to be released from the nose as the blood vessels dilate and the loose junctions start to allow fluid, ultrafiltrated serum to pass through, which we call snot. Mm-hmm. And it's trying to wash out those allergens. So the nose can do that, or you could do it for it. So if you got a Navage, go to drsteve.com and just scroll down. You'll see one on there. You can get it from there, or you can buy it at your local CVS. And when times are bad, put the saline pod in there. Use distilled water only. Wash all those allergens out. It's less for the body to do. Mm-hmm. You can have a big abscess on your arm, and the body will eventually take care of it. Or we can lance the abscess, open it up, get all that shit out of there, and take some of the burden off of the body of having to do all the work.
Well, she mentioned only OTC medicine. She
Correct.
did not mention prescription medications.
That's correct. So let's talk about the OTC medications that she could use that are non-drowsy. What, you got a couple of them in mind, Tace?
I mean, Allegra D.
Correct.
If the D part doesn't make her nutso.
Oh, very good. I'm going to give you know what? You're learning the couching of the advice so that we don't get sued. So
Give thyself a bell.
So correct. You take these things if there's no contraindication to them. That is correct. So yeah, Allegra is fexofenadine. You can get the generic version at CVS or Walgreens or basically anywhere. 180 milligrams will last 24 hours. It's non-drowsy.
And the nasal sprays are very good.
Yep.
And then there's also Monty Lucast.
I knew old Monty Lucast.
Yeah.
He was a card shark, don't you know?
Lots of medicines out there. And the shots, I did the shots for a long time, and they really did help me.
Yeah. The shot. If you will do the shots, they will help as long as they identified the correct.
It's a giant
antigens.
Pain in the butt, though.
If they missed an antigen, it'll only help a little bit, and then you got to go back and get retested.
Yeah.
But so when Tacey mentioned the nasal sprays, there are a couple. One, if you don't want to carry your Navage around with you, you can just get Simply Saline. It is an aerosolized saline, and I stand over the John, because I don't want the mucus going into the sink so much. And I'll spray this stuff. I put my head down, spray straight up into my nose, and it's saline, so you can sniff it back and it won't cause any irritation. And then I'll spray both sides, let it kind of drain out, sit there for a second, then I'll blow my nose. So you get a big giant glob of disgusting mucus. And that will help a lot, too, if you don't do the Navage. And then the other nasal sprays are the over-the-counter steroid nasal sprays, Flonase and the like. And you can buy those. There are store brands, and you can get them relatively inexpensive. Mm-hmm. Don't fall for the Afrin allure.
Oh.
Afrin is great for 1 or 2 days. That's oxymetazoline if you have nasal congestion, that's, stuffed up nose. It'll open you up, but if you use it day after day after day, you'll get addicted to it. My ex-wife...
Your current wife got addicted to it as well.
Really?
Mm-hmm.
Well, but it wasn't as funny because my ex-wife, who at the time I was really having a lot of problems with, it was always fun seeing her walk around with this bottle of Afrin, having to spray every 15 minutes to keep things going. That's how addicted to it she was. So you have to take your little pleasures where you can get them. That's all I can say. But so be careful with that. But Sudafed or phenylephrine or the other things that they use in the D formulations can really help. But there are adverse effects from those, including fast heartbeat, high blood pressure, stuff like that. So just make sure the's no contraindications to that. Okay.
Hey.
Okay.
All right.
The Simply Herbals nasal spray.
Oh shoot! Oh, why didn't? Okay.
I don't remember.
You see, your stupid minds.
I don't remember the last time.
Idiot.
I don't remember the last.
He's a fucking idiot.
Last time the Navage guy came up here when it was 100 degrees inside.
You are one pathetic loser.
Sorry.
You get nothing.
All right. Yeah, that was an error of omission on my part, and not just because Scott's my partner. That stuff is awesome, and you can carry it around with you.
Yep.
The CBD version, I think, is probably better for home use, but you could. It just depends on your tolerance for CBD. It really helps me sleep, so I don't think I would do it during the day. But the regular, just Simply Herbals nasal spray is amazing.
Pretty good stuff, yeah.
Yeah, it is.
Thanks,
and you
Dr.
just put it in your pocket.
Yep.
All right.
All right, guys. Thank you.
All right. What else you got? Nothing?
That's it.
All right. Well, thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. We're coming up to a year without a contract. Don't say anything. I don't know what's going on. We're just flying under the radar as we always have.
Which
That's
is
totally
perfect.
fine.
Oh.
Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Let's do the opening real quick.
Yeah.
Yeah, so that noise came back, and it wasn't on the recording. Did you
I
notice
heard it
that the
once.
second time I played it? Yeah, but it wasn't the same. So I'm still going to have to mess with that thing. So if we could just reproduce it, if I could catch it doing it. I left the mic on purpose earlier today just to see if I could get it to do it.
Mm-hmm.
And that way I can swap out the cable. I may just swap out the cable and swap out the battery anyway.
Okay.
But I also can't tell that it's not the channel on the mixer. It could be the channel on the mixer too, you know?
It's hard to say.
Well, if I reproduce it, then I would switch to another channel. If it's still doing it, it's not the channel. It has to be either the cable or the microphone. There's no other thing it could be. Anyway, all right. All right, you ready to do the opening?
Let's do it.
Okay. Echo, tell me a bad joke.
Who flips pancakes and sucks blood? Count Spatula.
Wait a minute. What the hell was that noise that
I thought
she
you did.
made? No, I didn't.
Like a
make
growling.
That. Yeah, I was. No, we're not using that. That was terrible.
The devil came in here.
Shut up.
You might be right.
The devil's already in here, sitting across from me. All right, here we go. Let's try that again.
Why did the chicken cross the road? He got traded from the Yankees to the Mets. What did the father buffalo say to his son when he left for college? Bye, son. Why did the cat cross the road? Who knows why a cat does anything, honestly?
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why? He's a fucking idiot.
Give me the respect that I'm entitled to!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve, and my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred to the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Weird Medicine. Follow us on Weird Medicine at Twitter. Now follow us on, I guess it's X now. I'm not going to say follow us on X at Weird Medicine. I'm going to say follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Okay, very good. please check out stuff.drsteve.com. Stuff.drsteve.com. You just go over there. You can click straight through to Amazon, or you can scroll down and see stuff that we're talking about on the show all the time at stuff.drsteve.com. And check out Dr. Scott's website at simplyherbals.net. We'll talk about that in a little bit. Please, what? No, we are going to talk about it at some length, as a matter of fact. Check out patreon.com/weirdmedicine, patreon.com/weirdmedicine. That's our show with Tacey and me and others from time to time, where we just do things that are specific to that particular audience. And 100% of calls that come to that get read on the air. And we're going to be, I keep promising we're going to do live streams and stuff. We are going to do live streams. I just have to figure out the technology, and I have a real job, so I'm working on it. I promise I'm working on it. I promised my shrink I would come up here after Tacey goes to bed instead of doom scrolling YouTube videos with Jimmy Dore all night, and WATP and Misery Loves Company and stuff. So that's my homework for this week, and hopefully what that means is I'll get this microphone fixed up here so we can have another guest in the studio again, and I'll get the live streaming technology working, and et cetera, et cetera. All right?
All right.
All right, very good. And then I did 2 cameos this week, whoop-de-doo. They're $5. So because I like doing them, and I think that's the minimum that Cameo will allow me to charge. I would charge $1 if they would let me. And I just, say fluid to you, mama. Somebody gave me a script and wanted me to play certain music in the background and stuff. I'll do that. I'll do whatever.
For a small fee.
Yeah, for an extremely small fee. No, it's $5. I mean, what the hell? It's just fun. I just like to do it. It's fun. I do not consider myself a celebrity in any way, but I will say stupid stuff to people. So cameo.com/weirdmedicine. All right.
All right.
Yep. Thank you.
Cool.
You want me to leave this on, Scott?
No, you can turn it off. I don't have my acoustic up here. I've only got electric today. My acoustic mandolin.
I'm going to McDonald's.
You're going to McDonald's? What you going to get?
Big Mac.
Really? Ooh, do I want something?
Gross.
I love them. No.
Yeah, I don't think I want anything.
You don't want anything?
Nah, I'll make plopcorn or something later. I've got shit. We've got stuff to do. We took Beck's couch and stuff up there. Well, now we got a living room with no furniture in it, so we're gonna go buy furniture.
Got to go buy some furniture.
And then I gotta kill weeds, and I gotta do this, and I gotta do that. Anyway. Carissa came over last night, and we hung out. The doggies got to play. They like to play with each other.
Oh, yeah.
And we were just, all three of us, we were just like,
wiped out.
Yeah. And I'm like, what is wrong with me? So I sat down.
We had a long
I was going to come up here and fix the mic for today so Carissa could come or Seeker could come.
Yeah.
And I sat down to look at my phone, and I woke up, I think, at midnight. And then
wow.
And yes, I know. And then I went upstairs and tried to, I played with the kitty cat for a little bit, fell asleep, got ready for bed about 1 o'clock, and then woke up at 9, which I never do.
No.
And it was, the whole thing was like 10 hours or 11 hours of sleep. It was crazy. So, okay. Were you able to send me the thing?
Already did. Sure did.
Weird Medicine.
Sure did.
Let me see. 08, 05. 23.
Yep.
Broadcast.
Should be the 12th. 8, 12, 23.
Yep. 8, 12, 23. Okay. Got it. Okay. All right.
Yep.
What are we going to play?
Let's play one.
Oh, well, it would help
do
if I had my bass.
Oh, no, yeah, you don't have a bass.
It's out there, and I had chords, so let me go get them. And you entertain the masses with your...
give me a little...
Yep. Okay, you got it?
Yep.
Let me hear you. There you go. All right. There you go. You can play a mandolin song for everybody.
Is there such a thing? Oh, yeah, I was fucking around.
That's not what I meant. Play a song that you know and sing. Or just noodle, that's fine. You and your noodling.
I'm a noodler by nature. All right, let's see what we got here. Oh, you want to play? And I don't think we've ever played this before.
Okay. Oh.
But
so
you
we
have
just
heard
played
this.
a gig.
But you have heard
for
this.
200 people. How many people were there?
Oh God, at least 200. At least.
It wasn't 200, but it was packed. And we learned a bunch of songs for it. And now you want to play something that we don't know? Okay, that's fine. It's fine. It's true to form.
That's about the truth for me, isn't it? Well, we could do first is something we actually do know.
How about that?
Oh, which one is that?
You don't know that one?
No, say it again. Do it again. Do it again.
What was it?
I'm trying to think what it was. What was it? D. Say that again.
Hang on. Does that say line input? What does it say? Hang on.
Let's hear some juice.
Hey, Sean Pedrick will be here next week.
Yeah, I know it. Oh, good old Sean. He'll be coming around the mountain.
Yep. All right.
Let's play something from our set list on Wednesday night. We'll play that first, and then I want to try something new.
Okay. Yeah.
Let's do the
All right. What do you want to play?
You know, it turned out pretty well though. That I thought was Folsom Prison. Have we done Folsom Prison up here in a while?
Yeah.
Yeah. How about I know we've done Friend of the Devil lately.
We have. Okay. Yeah. Okay. Well, then give me the new thing you want to do.
You want to, because I know we played Ripple up here recently.
We did.
Let's play. You want to play? Let's do Ripple. Then we'll play a new song. How's that sound?
Yeah, I can play
Let's do Ripple first. Yeah. Let's do a little ripple here.
God. Okay, you think you know it now?
I can't believe I forgot it between Wednesday and this morning. All right, here we go. In 3, 2, 1, here we go. You know what it is? I'm looking down, and I don't usually look. If my words did glow in the gold of sunshine, and the tunes were played on a harp unstrung, would you hear my voice come through the music? Would you hold it near as if it were your own? It's a hand-me-down. The thoughts are broken, and perhaps they're better left unsung. I don't know. I don't really care. Let there be songs to fill the air. Ripple in still water, where there is no pebble toss or wind to blow. Reach out your hand. If your cup is empty, if your cup is full, may it be again. Let it be known there is a fountain that was not made by the hands of men. There is a road, no simple highway between the dawn and the dark of night. And if you go, no one may follow. That path is yours, your steps alone. Ripple in still water, where there is no pebble top nor winds to blow. You who choose to lead must follow, but if you fall, you will fall alone. If you should stand, then who's to guide you If I knew the way, I would take you home. La da da da, la da 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 da, la da da, la da da, la da 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 da, la da da da, la da 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 da, la da da da, la da 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 da. Sorry about getting that thing cranked up. Huh? I said, I'm sorry about getting that started. It was just like I went on a brain freeze for a second.
Well, that's all right.
Oh, my gosh. Sorry.
I played in the wrong key for about half of it. So it's fine.
Yeah, it's okay. You were close. You were in the neighborhood. Hey, remember the old whale engineering
easiest song in the world?
It is. We just screwed it
okay.
up.
What?
Hey, the old whale engineering song, and Rodney Crowell covered it.
Okay.
It's called "Ain't Living Long Like This." I ain't living long.
Anal
like this.
living.
I ain't living long like this. Okay. And it's snappy.
Okay.
I look for trouble. I looked for trouble and I found this song. Straight down the barrel of a lawman's gun. I tried to run, but I don't think I can. You make one move and you're a dead man. Friend ain't living long like this. Can't live at all like this. Can I, baby? E7. See, handcuffs on behind my back and left me reeling on a steel wheel rack. I mean, all in the jailhouse, baby. Can't live at all like this, can I, baby? I don't know if I can do it in that key. Let me see if I can change it one. Let's go to G. Try that in G. I just think it's right in the middle of what I can't sing anyway. It accentuates my inability to sing. Try it. Hey, let's do this. I looked for trouble and I found it, son. Straight down the barrel of a lawman's gun. But I don't think I can. Make one move and you're dead, man. Say they ain't living long like this. Can't live at all like this, can I, baby? Thought that living behind my back and left me reeling on a steel reel rack. They got 'em all in the jailhouse, baby. Can't live at all like this, can I, baby? That's it right there, yeah. I think that's better. You think so?
That's fine, but
and we'll slow it down just there.
No, I don't care about how fast it is. I just can't tell when the changes are.
Yeah, it's a you just have to kind of guess.
Oh, you don't just guess.
You just maybe you'll get lucky. I like it in G. There you go. I looked for trouble and I found it, son. Straight down the barrel of a lawman's gun. I tried to run, but I don't think I can. You make one move and you're a dead man. Friend ain't living long like this. Can't live at all like this, can I, baby? He slipped the handcuffs behind my back and left me reeling on a steel reel rack. They got 'em all in the jailhouse, baby. Can't live at all like this, can I, baby? Grew up in Houston on a wayside drive, son of a car up in an all-night drive. Dad drove a stock car to an early death. All I remember was a drunk man's breath. Ain't living long like this. You can't live at all like got the story of the wheel goes round. Don't let them take you to the downtown, man. I can't all in the jailhouse, baby. Can't live it all like this, can I, baby? Can't live it all like this, can I, baby? I live with Angel, she's a roadhouse queen. Make Texas Ruby look like Sandra Dee. I wanna love her, but I don't know how. I'm at the bottom of the jailhouse now. I ain't living long like this. Can't live it all like this, can I, baby? Got the story at the jailhouse rock. You wanna do it, but just don't get caught. They got 'em all in the jailhouse, baby. Can't live it all like this, can I, baby? I can't live it all like this, can I, baby? It all like this, can I, baby? Isn't that fun?
No.
You were getting up and down that thing pretty quick there, big boy. I like it. It's getting those fingers warm. You must have got some sleep last night, Martins. All right, boys and girls, ladies and
thanks,
gentlemen.
everybody.
Hey, thank you guys. Hope you all had a wonderful day.